Hello, and welcome to another edition of Cafecito con NHCOA. During today's session, we will discuss diabetes in older adults and what you should know about managing this chronic disease as an older adult. Diabetes is a serious and growing health concern among Hispanic and Latino American communities, and it's especially common among the community's older adults. Diabetes can present new risks of serious complications for an older adult, like heart disease and vision loss. While there's no cure, millions of Americans have learned to manage their diabetes through healthy eating, physical activity, medication, and regular checkups. But let's hear more about this from our guest speaker, Betsy Rodríguez, an expert on diabetes. Ms. Rodríguez has over 25 years of professional experience as a nurse, diabetes educator, author, and bicultural specialist in health communication strategies focused on Hispanic and Latinos, African American, and American Indian communities. She retired in 2025 as a senior public health advisor at the CDC's Division of Diabetes after more than 2 decades of service. Thank you all for joining us today, and let's get started.
Let me start by sharing with you an analogy. Imagine your body is like a car, and glucose, of the sugar, is the fuel that powers it. Normally, insulin acts as the key that unlocks the full tank, allowing glucose to enter to your cells and give you energy. In diabetes, this is key either doesn't work well, and that's what is called insulin resistance, or isn't made enough, which is called insulin deficiency. It is like trying to fill your car tank, but the key is broken or missing. The fuel, the sugar, stayed in the bloodstream instead of powering your engine. For many adults in the Hispanic or Latino community, this problem is more common because of genetics, lifestyle factors like diet and activity, and challenges accessing healthcare. If the fuel keeps building up in the bloodstream, it can cause a serious damage to important car parts like the heart, the kidneys, the eyes, and the nerves. But the good news is that with proper care, like fixing the key insulin, choosing better fuel, healthy foods, for example, and maintaining the car like regular exercise and the medicine, people can keep their engine running smoothly for a long, long time and living a healthy life. Living with diabetes as an older adult is often more complex than younger people. Here is why. Let me explain you why. First of all, there are multiple health conditions that is called comorbidities. Older adults frequently may have chronic conditions like high blood pressure, heart diseases, arthritis, cognitive decline. That definitely will impose a lot of challenges on older adults to manage diabetes on a day-to-day basis. The second aspect that I would like to mention is the fact of the polypharmacy. That means many medications. Managing diabetes often involves taking several medications. Why? Because diabetes is more than a sugar problem. And when combined with medicine for other conditions, it increases the risk for drug interactions, side effects, confusing with dosing, and sometimes it can even increase the risk for hypoglycemia or low blood sugar. The other aspect that it's different from younger is the physical limitations, changes in vision, mobility, dexterity, many older adults may have arthritis, can make tasks like glucose monitoring or even insulin injections to be more difficult. Cognitive challenges, memory problems or dementia may interfere with safe diabetes self-management, like, for example, remembering medications or recognizing low blood sugar reactions or symptoms. The risk for hypoglycemia is something that we clinicians fear a lot in older adults. That means low blood sugar. Older adults are more vulnerable to severe lows, which can lead to falls, to confusion, or to hospitalization. This is why individualized treatment goals are so important. And last, there are different priorities. In older adults, the focus often shifts from tight control to quality of life, avoiding complications, and most important, maintaining independence, which I believe it's what keeps the dignity of those that are in the older adult stage. When it comes to older adults, I will say that one of the most important aspects to highlight here is the fact that there is an increased risk for falls and fractures due to the neuropathy, due to the poor vision, due to the muscle weaknesses, due to balance issues. Older adults with diabetes have a higher risk for falls, which can lead to serious injuries. Hypoglycemia. Older adults are more vulnerable to severe hypoglycemia, and this can cause confusion, seizure, loss of consciousness. This risk then is going to increase for multiple medications, and that's what I was talking before about the polypharmacy. That is so important for caregivers to know that occasionally it should be requested an evaluation with the pharmacist around all the medications that the older adults might be taking. And then we have also what comes to age, it's just that get more complicated when you have diabetes, and that is the cognitive decline. Diabetes is linked with high risk of dementia and Alzheimer's disease, complicating even more the self-management. And then you have also, we're more than numbers, right? So we have to think also about depression and social isolation. Chronic illness can contribute to mental challenges, which on the other hand will affect diabetes control and also quality of life. And finally, medication side effects. Older adults often take multiple medications, raising the risk for adverse effects or drug interaction. Older adults over 45 should be tested at least every 3 years or earlier if they have risk factors. And risk factors can be changed. There are some that are modifiable and some others that we cannot modify them. So I would like to start talking about those factors that people can take action on, like obesity or overweight, physical inactivity, unhealthy diet, especially a diet high in added sugars, in refined carbs, in saturated fats, high blood sugar or hypertension, high cholesterol or lipid, like triglyceride problems. All of those things are risk factors that definitely people can take action on. But then on the other hand, we have risk factors that cannot be changed, and that is age. Diabetes increase the risk of developing diabetes after 40 to 45. If you have a family history of diabetes, especially first degree relative, your ethnic background, higher risk, Hispanic or Latinos. If there is any special or personal history or gestational diabetes, the type of diabetes that is developed when the woman is pregnant. Or if they have low birth weight or being born premature. Well, let me tell you, a healthy diet, regular physical activity, weight management, sleeping well, the motion, health, all of those things will work not only for older adults, it works for the entire population. If people were eating better, being more physically active, avoid smoking, sleep well, and manage the stress, many of the chronic conditions that the majority are experiencing right now, like diabetes and cardiovascular diseases and even cancer, could be prevented or delayed. So regular checkups is also important, and knowing your numbers are key practices. And I don't want to get in all of those numbers because I don't want to drive you nuts, but you will say that for older adults, for example, the individualization is the key, because clinician will have the tendency to be having less strict targets to reduce hypoglycemia in older adults. So for postprandial blood glucose, for example, in an older adult living with diabetes, 2 hours after a meal, we can say around less than 180. For blood pressure, less than 140 to 90. So in other words, the numbers are going to be quite different in older adults because of the risk of hypoglycemia and the many things that I already explained before. So that's why individualization is the key for older adults. That's a good question, because there is a tendency to think that you have to sacrifice your traditional flavors, regardless of where you're coming from, Guatemala, El Salvador, Puerto Rico, whatever. I'm from Puerto Rico. And if you're telling me you're taking away the tostones away from me, oh my God, I will be extremely sad. So it is possible to enjoy traditional foods in moderation. It's just that the people will have to learn how to make those swaps, like choosing whole grains like brown rice, beans, grill instead of fried options, and add more veggies to the plate. Portion size is an important aspect. Balance is the key. Yes, you can enjoy the traditional food. It's just a matter of changing the way you usually cooked, and avoid processed food like everybody else is, and then cooking in a different way. Well, a treatment plan, especially a treatment plan that is individualized, will help maintain blood sugar within a safe range, and that will help to avoid complications. All of those complications that I was talking about before, the eyes, the nerves, the heart, all the kidneys, all of that, with good treatment, helping you keep your blood sugar within a safety range, will avoid those complications. So without proper management, diabetes can lead to serious issues affecting quality of life and independence. We have the tendency to overprotect our older adults, forgetting that they need, yes, they might need company, they might need support, but they also need independence when it's possible to have it. We should avoid taking over the person's independence. I think that that's very important. We cannot take over the independence of our older adult, yet we can support them. Tender loving care, meal planning, medication reminders, going to appointment, encouraging physical activity, that will be more than enough, I will say. There are many out there. There are many community health centers. There are promotores de la salud that are available. There are many organizations. And actually, if you go to the National Association of Community Health Workers, NASHWA, You will find there in their webpage a list of state, local, and national community health worker groups, diabetes education classes, and there are many support groups and programs with organizations like the American Diabetes Association, the Association of Diabetes Care Education and Support Specialists, ADCS. Both have accredited or recognized diabetes programs, and each of them has a program locator. Well, we have to have respectful, loving conversation. We can share stories or examples they can relate to and involve them in decisions. Small steps go a long way when changes are made together as a family. So it is important to encourage our parents, our grandparents, talking with love, but also with respect, avoiding judgment, right? Use stories of people that they trust as an example. Cook, walk, or go to appointments together. Celebrate small wins. Remind them again and again and again. Pa, ma, grandpa, grandmother, we are here in this together, and I'm here to support you because I love you.
Thank you all for joining us today and learning more about diabetes, its health risks, treatments, and prevention methods. We hope this session of Cafecito con NHCOA proved a valuable and insightful conversation for you all. And a big thank you to today's expert speaker, Betsy Rodríguez, as well, for the wealth of knowledge and excellent guidance that she provided us with today. We invite you to share this edition of Cafecito con NHCOA with your family members, friends, and community. And don't forget to stay connected with us through our digital platforms and social media, as at NHCOA for more resources, updates, and future events. Until the next Cafecito con NHCOA. Bye-bye.